In 2024, a young black woman arrived at St. Mary's Hospital. She was in excruciating pain. She was struggling to breathe. This young woman was experiencing a pulmonary embolism, a life-threatening condition, yet she was denied the care she desperately needed. Instead of receiving treatment, she was forcibly removed from the hospital. She later died. This tragic incident, sadly, is not an isolated event. It is a harsh reminder of the systemic racism that permeates our healthcare system. This young woman's story is a stark illustration of the deadly consequences of healthcare inequities. Her life ended not because of her medical condition, but because of a system that too often fails people of color. Her story demands our attention. It demands justice. The tragic death of this young woman exposes a deeply troubling reality. Systemic racism infects our healthcare system. Black Americans in particular face alarming disparities in healthcare. Studies show that black patients are more likely to experience misdiagnosis. They are more likely to be denied pain medication. They are more likely to face worse health outcomes. These disparities are not random. They are deeply rooted in a long history of discrimination and prejudice. These statistics paint a grim picture. The numbers represent real lives lost, families torn apart, and communities devastated by preventable suffering. We must confront these injustices head-on. We must demand better. My own experience within the healthcare system mirrors the struggles faced by countless others. I battled severe anaphylaxis and a debilitating mast cell disorder. Instead of receiving proper care, I was misdiagnosed. I was dismissed. My pain was ignored. This misdiagnosis had devastating consequences for me and my family. I endured unnecessary suffering. I lost precious time. I lost custody of my children. My story is not unique. It is a story echoed by countless black patients who have been failed by a system that should protect them. We must listen to these stories. We must learn from them. We must demand change. Section 4. The erosion of trust. The impact of healthcare inequities. These injustices have a corrosive effect on trust. When black patients are consistently marginalized and mistreated, it erodes their faith in the healthcare system. This distrust can have dire consequences. It can lead to delayed care. It can lead to avoidance of medical treatment altogether. This lack of trust is not simply a matter of perception. It is a matter of life and death. When trust is broken, lives are lost. Section 5. The human cost long-term health consequences. The consequences of healthcare disparities extend far beyond individual tragedies. They have a profound impact on the long-term health and well-being of entire communities. Black Americans experience higher rates of chronic illnesses. They have shorter life expectancies. They face a disproportionate burden of preventable suffering. These disparities are not inevitable. They are the direct result of systemic inequities that must be addressed. We must work to dismantle the structures that perpetuate these disparities. We must strive for a future where health outcomes are not determined by the color of one's skin. Section 6. The role of bias. Implicit and explicit discrimination in healthcare. These disparities persist in part due to pervasive biases. Implicit bias, often unconscious, can influence medical decisions. It can impact the quality of care provided. Explicit bias, overt and intentional, is equally harmful, leading to discrimination and mistreatment. We must acknowledge the role of bias in healthcare. We must implement training programs to address implicit bias. We must hold healthcare professionals accountable for discriminatory practices.